You know, I've been practicing medicine now for over 30 years. Started in internal medicine, then moved more and more into geriatrics as I got older myself. Funny how that works. And there's something I've watched happen over these decades that genuinely troubles me. Most of my patients over 70 come in feeling pretty good about their health habits. They show up for their appointments. They get their blood work. They schedule their screenings. They do what they've been told responsible people do. And I respect that. I truly do. But here's what keeps me up some nights. I've watched patients walk into my office feeling fine, really fine, and then walk out of a specialist's office 2 weeks later with a diagnosis that changes everything. Not because they were sick, but because we went looking for something. And when you look hard enough, especially in a body that's been around for 7 or 8 decades, you're going to find things. Things that would never have caused a problem. Things that sound terrifying on paper, but were just sitting there quietly, bothering no one. Let me give you a few numbers that might surprise you. About 30% of women over 70 who get routine bone density scans will be told they have osteoporosis. 30%. But the majority of those women will never break a bone, ever. Here's another one. Studies have shown that up to 40% of people over 80 have brain abnormalities on MRI that look like small strokes. 40%. Most of them have never had any symptoms whatsoever. And this one really gets me. Research published in major medical journals has found that full-body CT scans in healthy people find something abnormal about 90% of the time. 90%. But most of those findings are what we call incidental, meaning they weren't causing any harm and probably never would. So why does this matter? Because every finding leads to something. Another test, a biopsy, a referral, sometimes surgery, sometimes medications with real side effects. And sometimes, more often than we like to admit, those follow-up interventions cause more damage than the thing we found. I'm not here to scare you away from doctors. That's not my point at all. I've dedicated my life to this profession, and I believe deeply in medicine done well. But medicine done well means knowing when to look and when to leave things alone. It means understanding that in an older body, the calculus changes. What helps a 50-year-old might genuinely hurt a 78-year-old. So let's talk about this honestly. The way I'd talk to you if you were sitting in my office. Let's start with something most of my female patients ask about. Bone density testing, the DEXA scan. Now, on the surface, this makes perfect sense. Osteoporosis causes fractures. Fractures in older people can be devastating, especially hip fractures. We know that hip fractures in people over 80 carry a significant mortality risk in the year following. So preventing them seems obviously important. And it is important. In the right patient, at the right time, with the right response to the results. But here's what happens in practice. A 73-year-old woman, let's call her Patricia. She was a retired teacher, lovely woman, walked 2 miles every day, did her gardening, felt great, comes in for her annual visit. The previous doctor had ordered a DEXA scan. It came back showing a T-score of -2.6 inches her spine. Now, technically, that's osteoporosis. That's the cutoff. So Patricia was started on a bisphosphonate medication. Within 4 months, she was having significant stomach pain. She stopped walking as much because she didn't feel well. She developed reflux. She was put on another medication for that. Over the next 2 years, I watched her slowly become someone who thought of herself as fragile, as having bad bones. She stopped gardening because she was afraid of falling. Her world got smaller. And here's the thing. That number, -2.6, what does it actually tell us? It tells us her bones are less dense than the average 30-year-old woman. That's what the T-score compares to. A 30-year-old? Of course, they're less dense. She's 73. The more relevant question is, what's her actual risk of fracture in the next 10 years? And that depends on so many other things. Her balance, her muscle strength, her vision, whether she has throw rugs in her house, whether she takes medications that make her dizzy. There's a tool called FRAX that calculates this more meaningfully, and even that has its limits. What I've learned, and what the research increasingly supports, is that for many women over 70, especially those who are active and have never had a fracture, the benefits of those medications are marginal at best. The studies that showed the biggest benefits were mostly done in much higher risk patients. Meanwhile, the side effects are real: jaw problems, unusual fractures of the thigh bone, gastrointestinal issues, and perhaps most importantly, a psychological shift towards seeing yourself as fragile. The better first step for someone like Patricia? Vitamin D, weight-bearing exercise, home safety evaluation, maybe physical therapy for balance training. These things work. They don't show up on a scan, so they don't feel as medical, but they prevent falls, which is what actually matters. I'm not saying no one should ever get a bone density scan. If you've broken bones before, if you've lost a lot of height, if you have certain other conditions, then yes, it might be useful. But as a routine screening for everyone, at every age, that's where we've gotten ourselves into trouble. This one is close to my heart because, honestly, memory concerns are one of the most common things I hear about from patients in their 70s and 80s. Doctor, I forgot my neighbor's name the other day. I walked into the kitchen and couldn't remember why. I lost my keys twice last week. And these worries are understandable. Dementia is frightening. We've all known someone who went through it. The fear of losing yourself, there's nothing quite like it. So, the request comes naturally. Can we just get a scan? Just to check? And here's where I have to be careful in how I explain this. A brain MRI for mild, typical age-related memory concerns is in most cases not going to help, and it might really hurt. Let me explain. First, what will the scan show? In almost everyone over 70, there will be findings. White matter changes, small areas that look like old strokes, maybe some shrinkage in certain areas. These findings have scary-sounding names, and seeing them in a radiology report can be devastating. I had a patient, Harold, 81, former engineer, sharp as a tack in conversation, who got a brain MRI after he mentioned some occasional word-finding difficulties. The scan came back showing moderate chronic small vessel ischemic changes and mild generalized atrophy. Harold was terrified. He interpreted this as the beginning of the end. He became withdrawn. He stopped playing chess, which he'd loved for 50 years. He told his daughter he should probably give up driving, even though there was no evidence he needed to. When we sat down together, I spent a long time explaining that those findings are present in the majority of people his age, that they don't necessarily correlate with function, that what matters is what he can actually do, and he could do quite a lot. But the damage was done. He'd seen the pictures. He'd read the words. And in his mind, his brain was diseased. This is what we call the harm of knowing something that sounds terrible but doesn't change what we would do and doesn't change the outcome. If Harold had actual symptoms of dementia, if he was getting lost in familiar places, if he couldn't manage his finances anymore, if his personality had changed significantly, that would be different. In those cases, a scan might help rule out other causes, tumors, bleeding, something reversible. But for typical age-related forgetfulness, which, by the way, is a real thing and doesn't necessarily progress, a scan usually leads to worry, not clarity. What actually helps? Cognitive stimulation, social engagement, exercise, yet again, good sleep, treating hearing loss, which is hugely underappreciated as a contributor to cognitive problems, depression screening, medication review, because many drugs affect memory. These things make a real difference. An MRI showing white matter changes, in most cases, that just tells you you're getting older, and you already knew that. Now, let's talk about the heart. This is another area where our instincts lead us astray. The cardiac stress test, walking on a treadmill while hooked up to an EKG, or getting a nuclear medicine scan of the heart, is a reasonable test in the right situation. If you're having chest pain, if you get short of breath climbing stairs when you didn't before, if something has changed. In those cases, we're looking for a reason for your symptoms. We're trying to help you. But what I see far too often is this. A 74-year-old man comes in for a physical, feels fine, no symptoms, no chest pain, exercises regularly, and somewhere along the way, someone orders a stress test, just to check the heart. This is where it gets complicated. The problem with screening tests in people without symptoms is something called the pretest probability. What's the likelihood that this person has significant coronary artery disease that's about to cause a problem? In a low-risk person, someone who exercises, doesn't smoke, has controlled blood pressure and cholesterol, that probability is low. And when the probability is low, a positive test is more likely to be false. A false alarm. Let me say that again because it's so important. In low-risk people, many positive stress tests are wrong. But you don't know that at the time. All you know is that your doctor says there's a concern and now you need a cardiac catheterization. So you go to the hospital. They thread a catheter through your artery into your heart. They inject dye and take pictures. That procedure is not nothing. There's a small but real risk of bleeding, infection, damage to the artery, allergic reaction to the dye, kidney injury from the dye. In rare cases, stroke or heart attack from the procedure itself. And after all that, many times they find nothing significant, or they find a mild blockage that wouldn't benefit from a stent anyway. I think of a patient named George, 76, retired postal worker, still golfed twice a week, no symptoms at all. His doctor ordered a stress test as part of a complete workup. The stress test was mildly abnormal, so he went for a catheterization. They found a 50% blockage in one artery, not enough to need intervention. He was reassured, technically, but the procedure caused some bruising in his leg that took weeks to heal. He was put on another medication, and he told me he felt like a heart patient now, even though nothing had really changed. The research is very clear on this. Screening stress tests in asymptomatic older adults do not improve outcomes. The major medical organizations actually recommend against them in most cases, but they still happen constantly. Why? Because they feel like we're being thorough, because patients ask for them, because the system is set up to do more, not less. The better approach for most people? Focus on what actually reduces heart disease risk. Blood pressure control, cholesterol management if appropriate, exercise, not smoking, diet, managing stress. These are boring answers. They don't involve machines or pictures or procedures, but they work. Now, this topic takes some care to discuss because colon cancer is a real thing that really kills people, and screening has saved lives. But there's a real question about when screening should stop, and for many people, that's somewhere around 75. Let me explain the reasoning. Colon cancer typically grows slowly, very slowly. From a small polyp to a cancer that causes problems, we're often talking about 10 to 15 years, sometimes longer. So when you do a colonoscopy in a 55-year-old and find a polyp, you're potentially preventing a cancer that would have appeared in their late 60s or 70s. That's a real benefit. But when you do a colonoscopy in a 78-year-old and find a small polyp, you're preventing a cancer that might appear when they're in their late 80s or 90s. And many people won't live that long anyway, not because of colon cancer, but because of everything else. This sounds harsh, I know, but medicine requires us to think about these things honestly. Meanwhile, colonoscopy in older adults carries higher risks. The bowel prep is harder to tolerate. Dehydration is more common. The risk of perforation putting a hole in the colon goes up with age. Anesthesia carries more risks. I remember a patient, Dorothy, 82. She'd been getting colonoscopies every 10 years like clockwork, and she was due for another. She asked me if she really needed it. I said, "Dorothy, your last 2 colonoscopies were completely normal, no polyps at all. You're 82 years old. You have some heart issues we're managing. The prep would be hard on you. And honestly, the chance of finding something that would matter in your lifetime is very small. I don't think you need it." She actually looked relieved. She told me she'd been dreading it, but felt like she had to. That's the thing. Many patients feel obligated, like they're being irresponsible if they don't do every test. And doctors sometimes feel that way too, afraid that if they don't order the test and something happens, they'll be blamed. But the guidance is actually clear on this. The U.S. Preventive Services Task Force recommends against routine screening colonoscopy after age 85 and says it's an individual decision between 76 and 85 based on overall health. For someone in excellent health at 77 who's never been screened, maybe it makes sense. For someone with multiple other conditions who's already been screened several times with normal results, it probably doesn't. What matters is having the conversation, not just automatically scheduling the procedure because it's time. And now we come to what I consider the most problematic of all, the one that genuinely worries me. Full-body CT scans, executive physicals, whole-body screenings, whatever you want to call them. These are marketed aggressively. You've probably seen the ads. Take control of your health. Find problems before they find you. Peace of mind. They sound wonderful. Who wouldn't want that? But let me tell you what actually happens. Remember that statistic I mentioned at the beginning? About 90% of healthy people showing something abnormal? That's not an exaggeration. When you take detailed pictures of every organ in someone's body, you find things, always. A small cyst on a kidney, a nodule in a lung, a shadow on the liver, an aneurysm in an artery, thyroid irregularities, adrenal incidentalomas, as we call them, little growths on the adrenal glands that are almost always benign. Each one of these findings creates a cascade. A lung nodule means a follow-up CT scan in 3 months, then maybe another in 6 months, then maybe a biopsy. The biopsy carries risks, bleeding, infection, collapsed lung, and very often, after all that, it turns out to be nothing. A scar from an old infection, a benign growth, something that was never going to hurt anyone. But you've spent months worrying. You've had procedures. You've been a patient instead of living your life. I had a patient, Frank, 74, very successful businessman, felt great, no symptoms whatsoever, who decided to get one of these full-body scans as a birthday gift to himself. His wife had encouraged it. The scan found a small nodule in his lung, about 8 millimeters. Frank was convinced he had cancer. He couldn't sleep. He stopped making plans for the future. His wife told me later that he seemed to age 10 years in 2 months. We followed the nodule with repeat scans. It didn't change. After a year of worry and imaging, the pulmonologist concluded it was most likely a benign granuloma, basically scar tissue from some old exposure, maybe a fungal infection decades ago. Frank was fine. He'd always been fine. But that year of anxiety, the repeated radiation exposure from all those CT scans, the strain on his marriage and his mental health, that was real harm. And here's what rarely gets discussed: radiation. CT scans involve significant radiation exposure. A full-body CT can deliver the equivalent of several hundred chest X-rays. That radiation carries a small but real risk of cancer, especially cumulative risk from repeated scans. So we irradiate healthy people. We find things that weren't causing problems. We follow up with more radiation. We do biopsies. And sometimes we cause the very harm we were trying to prevent. The medical literature on this is quite consistent. Whole-body CT screening in asymptomatic adults is not recommended by any major medical organization. Not one. The evidence does not support it. But it's profitable, and it sounds good, and people pay cash for it because insurance won't cover it, which should itself tell you something about whether the science supports it. I understand the appeal. I really do. The idea that you could just check everything and know you're okay. But the human body doesn't work that way. We all have incidental findings. We all have variations. The question is whether looking for them makes us healthier or just makes us patients. So, where does this leave us? I want to be very clear about something. I'm not telling you to avoid doctors. I'm not telling you to refuse all tests. That would be irresponsible of me, and it's not what I believe. What I am telling you is that more is not always better, especially after 70, especially in a body that has accumulated decades of minor variations that look abnormal on paper but function perfectly well in real life. There's a concept in medicine called choosing wisely. It means thinking carefully about which interventions actually help versus which ones just feel like we're doing something. Real preventive medicine at 75 looks different than it did at 55. At 75, it's about preventing falls, maintaining muscle strength and balance, staying socially connected, managing the conditions you already have, taking fewer medications when possible, not more, keeping your mind active, sleeping well, eating reasonably without obsession, continuing to do what gives you meaning. It's not about chasing numbers or scanning every organ or taking every test just because it's offered. The best doctors I know, the ones who have been at this as long as I have, they've learned to say no more than they used to. Not from laziness, from wisdom. One of my mentors used to say, "The art of medicine is knowing when not to do something." I think about that often. What can you do? If you're scheduled for a test, ask questions. What are we looking for? What will we do if we find something? What will we do if we find something that might not matter? What are the risks of the test itself? What would happen if we didn't do this test? Good doctors will welcome these questions. They'll be grateful you're thinking carefully. If a doctor is dismissive or seems offended, that tells you something too. You are allowed to say, "I'd like to think about this," before we schedule it. You are allowed to ask, "Is this going to change what we do?" You are allowed to consider your age, your values, your priorities, and how you want to spend your time. When I have patients ask me these questions, I feel hopeful. It means they're engaged. It means they see themselves as more than a collection of test results. It means they're still living. I've taken care of thousands of patients over these 30-some years. And the ones who aged well, the ones who were still engaged and curious and happy in their 80s and 90s, they weren't necessarily the ones with perfect cholesterol or pristine scans. They were the ones who kept moving, who stayed connected, who didn't let fear of disease become the disease itself. One of my favorite patients was a woman named Vera. She passed away a few years ago at 94. She'd refused several tests over the years, not aggressively, just thoughtfully. She'd say, "Doctor, would this really help me, or would it just find more problems?" Often, I had to admit it would just find more problems. She lived independently until 91. She gardened, she read, she had visitors, she drank a glass of wine with dinner. She died peacefully, in her own home, in her sleep. That's not a failure of medicine, that's a success. Not every story ends that way. Some people need intervention. Some people benefit enormously from early detection. I've seen that too. But the idea that we should scan and test and screen everyone for everything at every age without considering whether it helps, that's not wisdom. That's fear dressed up as medicine. You deserve better than fear. You deserve a thoughtful conversation about what makes sense for your life, your body, your values. And if you haven't been getting that conversation, I hope you'll ask for it. Thank you for spending this time with me. I know it's a lot to take in. These aren't easy topics, and I don't have all the answers. Nobody does. But I hope I've given you some things to think about, some questions to ask, maybe some permission to say, "Let me think about that," the next time a test is recommended. Medicine works best when it's a partnership, when you're involved in the decisions, when your voice matters. Your voice matters? If this raised questions for you, write them down. Bring them to your next appointment. Talk to your doctor. Really talk. And if you found this helpful, feel free to share it with someone you love. Not because I need the attention, but because these conversations should be happening in every family, at every kitchen table. Before the next appointment, take care of yourselves.